We know that NCDs now have overtaken infectious diseases and are the #1 killers. More than 63% of deaths in the world are due to these 4 main conditions. But beyond that, it's even more alarming to note that many of these deaths, in fact 9.1 million, are people under the age of 60. In other words, in the prime of their lives, we are losing and burying our loved ones at a very rapid and increasingly rapid rate. And many of those deaths could have been prevented. Then we know that because we're losing so many of our people in the prime of their lives, it's having an economic impact and it's stagnating the growth, particularly among developing countries. And because the threat is so far-reaching and the implications are so far-reaching, we accept that the health sector cannot address it alone. So we must all come together and work effectively if we are to succeed in reversing the threat that NCDs pose to our families, our community, and our economy. So we see then that NCDs has effects both on the individual and the wider community. This is where we derive the concept of health as a public good. In other words, your health affects me, and my health affects you. So it's not just a matter of individual concern. For the individual, we know that the effects can be debilitating. Renal failure, the Premier mentioned, or high rate of persons on dialysis in the territory. Blindness, we know somebody in each of these categories. Amputees, persons having heart attacks, strokes, and ultimately leading to premature death and disability. But beyond that, we know that NCDs drive millions of people into poverty every year, and poverty affects all of us. It means higher spending in terms of social programs, but also it places a burden on the healthcare system, the health financing system. We mentioned that it reduces productivity of the workforce and therefore stagnates the entire economy. So, what do these NCDs look like, and how do we know that we are at risk for developing NCDs? Well, we know the biological risk factors. We look to the individual and we see raised blood pressure, red flag, blood glucose, cholesterol, overweight, and obesity, and particularly the size of the circumference of your waist is an indicator of whether you're at high risk for developing an NCD. And so those are flags that we can point to and say, wait a minute, we're on the path towards developing these problems. But what are the things that are driving these conditions to manifest themselves in the individual? And we found that there are some common risk factors. Mr. Georges spoke about diabetes and the activity of the Diabetes Association. And if the president of the Cancer Society were up here, the message would be about preventing cancers, and we could take each disease in turn and try to help people to understand the seriousness of the implications of each one. But what researchers have found is that there are some risk factors that are common to all NCDs. So if we address the common risk factors, we address all of them. And so working together makes the most sense. We can pool our resources, advocate, strategize, and implement programs that would address NCDs comprehensively. So the 4 leading risk factors that have been identified are tobacco use and exposure to secondhand smoke. And we've made some strides in tobacco control in the territory, and we still have some ways to go. Harmful use of alcohol, binge drinking we call it. It's a curse of the Caribbean. Every corner is a rum shop, right? Unhealthy diet, I don't have to elaborate on that, and lack of physical activities. If we can address those 4 things, then we could reverse the trends that we're seeing. But how easy is it to address those things? Is it down to individual effort and people just being disciplined enough and committed enough to their families and themselves to eat? Why can't we just eat right and do the right thing? Just do it, one of those slogans say, right? Just say no. Well, it's because human beings are not always rational in their decision making, and part of the reason for that is that there's forces in society that influence choice. And we know that we've seen a transition in our society from physical labor, toiling in the garden and the fields and fishing and that sort of work, to more sedentary lifestyles, right? How many people in here actually work in an office environment or an environment where you sit most of the day? Let me see your hands. Majority do. So because of this shift, we find that has an impact on what we're seeing as well. But very importantly, global trade and marketing. I think we all now realize the power of marketing. Everybody on Facebook would understand that people have dedicated their entire careers to understanding you. What you like, what your preferences are, what you think. Everything, every time you click like on Facebook, it's registering somewhere. And suddenly you see ads popping up on your page that talks about the things that you want to buy or the things that you're interested in. Because there's a whole science and a whole industry around marketing and ensuring that people tailor their message to what will entice you to buy or to behave in a way that they would want you to. So free choice isn't really as free as we imagine it to be. And just one example of the powerful marketing that impacts on that. And closely linked to this is nutrition, because there's quite an extensive amount of research. If you just Google snack foods, and if you could understand the magnitude of research that goes into making that potato chip irresistible, then you realize that it's you against great forces in the community that encourage persons to just have one more. Or you can't, you must have a Snicker bar in order to satisfy that hunger, or whatever the message is. It's constantly reinforced and affecting the choices that individuals make. You couple that with ignorance and poverty, and we have a high prevalence of poor choices. So we find that if we are to make a difference in influencing behaviors, we must go beyond education. It's not enough for people to know what the right thing to do is. We must create positive forces in the environment that would encourage healthy choices to counteract the negative influences. So the Caribbean region, I think, was the first to take the lead on this issue because, as we said, we're the worst affected. And we heard mention of the 2007 CARICOM Heads of Government Summit on NCDs and the declaration that resulted from it. And then we took the message global. And in 2011, there was a UN high-level summit on NCDs. And it was only for the second time in history that the UN General Assembly devoted its exclusive attention to a health-related issue. Who knows what was the first health issue that the UN General Assembly addressed? No health people. What was the health topic that the General Assembly met to agree to an international response before NCDs? HIV/AIDS. So it was quite a significant milestone that countries from around the world came together and agreed to develop and to take steps to implement national NCD plans. Now, I mentioned this was in 2011, and the Virgin Islands was actually quite ahead of the game by that time. We had actually already developed our national NCD plan by then. But why did we feel it necessary to make to develop that plan? It's because we had done our research, and when we conducted the survey in 2009, we found that almost half of the population had 3 or more risk factors for NCDs. In other words, they were practically certain, if nothing changed, it was practically certain that nearly half of the population was going to be stricken with one of these diseases. And just to give an insight into one of those risk factors in the BVI, just to look at the results on obesity alone. slide. So, there we have it. Less than a quarter of the population was not overweight. 75% was either overweight. This is overweight. And this is what? Obese. That is alarming by any measure. That 75% of your population could be either overweight or obese. So, beyond that, we found that in a study of school children, similar issues presented themselves. So we saw that the problem was only going to get worse in the future. So we moved to develop the 10-year strategy on NCDs. Next slide. As I mentioned, it was based on research. It outlined the vision, goals, and direction for various stakeholders. And it called for an all-of-government and an all-of-society approach. There are three basic implementation structures, which most of you are familiar with because you fit into one of them. The Community Health and Wellness Councils, the Interdepartmental Technical Working Group, and the Advisory Council with the Ministry of Health and Social Development providing technical and secretarial support. Next slide. So, the Community Health and Wellness Councils, this is where everyone gets involved. And we envision that the councils is the form where we could bring parties together at the community level, civil society groups, individuals, nonprofits, businesses, and government agencies working at the community level, coming together to promote active community participation in leadership and planning, and evaluating the long-term sustainability of the plan. We've established community councils in these 4 communities with the hope to expand to other communities in time. The Interdepartmental Technical Working Group, you'll hear more about, essentially to coordinate activity among government agencies, because we know public policy is an important part of the change, but we cannot achieve much if we work in silos or in competition with each other. So coming together, planning together, addressing any barriers that we might see, and advocating for resources around the joint strategy is the main focus of that group. And the main sectors included are transportation, planning, education, sports and recreation, labor, finance, and agriculture. Now, under that structure, we have some subcommittees focusing on key risk factors. There's an alcohol and tobacco committee, physical activity, and food and nutrition, which is taken forward by the National Food and Nutrition Council. And then there are 4 committees that focus on settings: healthy schools, healthy workplaces, healthy spaces and places, looking at the built environment, and healthy communities as well as effective healthcare services. As I said, you'll hear more about the activities of those committees as we go forward. Next slide. And then it's coordinated by Mr. Georges and his team on the Health and Wellness Advisory Council, which is made up of public and private sector representatives. They're charged with holding all stakeholders accountable for delivering on the objectives of the plan. They advocate for resources, and very importantly, they monitor compliance with the mandates of the Port of Spain Declaration and the UN Political Declaration for the Prevention and Control of NCDs. You won't be able to read that, but that depicts the structure. And I'm sorry if I rushed because the time is very limited, but we will have an opportunity to hear more about what is taking place at each level in order to achieve the objectives of our 10-year strategy. So thank you so much for your attention.